These companies are not just making profits, they are making the prophetic vision of Israel as a light unto nations come true. Because these companies, from the 15th smallest country in the world, are changing the world. So, enough talk about innovation. Let's meet some of these technologies. And we're going to start in the medical field. Imagine if you could take a brief, painless, non-invasive test that could predict a heart attack as far as 7 years out. Well, the Israelis figured out a way to do exactly that. With us tonight is Dr. Sivan Abril. Dr. Abril is the National Medical Director for Itamar Medical, inventors of a dynamic new technology called Endo-PAT. Sivan? So, Sivan, what is Endo-PAT?
Okay, Endo-PAT, endo stands for endothelium, PAT stands for a new physiological signal in medicine as a PAT. Endo-PAT is the only FDA-approved non-invasive device, office-based procedure, 15 minutes long device that measures endothelial function. The endothelium is the inner lining of each and every artery and vein, and that's the largest organ in our body. And this organ actually responsible to secrete materials that either dilate the vascular smooth muscle or constrict. And that's the earliest stage of detection of cardiovascular disease.
So, this is a... explain to me how this works.
Okay.
I didn't go to med school yet.
Not yet?
No, not yet. There's still time.
Okay. So as we mentioned, Itamar Medical developed the PAT signal, which stands for peripheral arterial tone. It's a new physiological signal in medicine that measures the changes of blood volume from our fingertip. The test lasts for 15 minutes. 5 minutes requires some baseline. Then we inflate the blood pressure cuff on the arm, same as blood pressure cuff measurement. And we would like to create complete occlusion. So we inflate the blood pressure cuff so there is no blood and no oxygen going through. And once we release the blood pressure cuff, we would like to see how the vessels respond to this occlusion. If the vessels respond well, they will secrete the material that will dilate the vessels and will create a large volume of blood to the arm.
So taking this test would allow somebody to know whether they needed to change their diet or increase their exercise regimen to prevent a heart attack?
What is very unique about this test is it gives you a number at the end of the study. So we can always refer to a number. What's my number? It's like a weight reduction. So once we give a patient a number, it's easier for them to refer to something as to give them let's say, a blood measurement or something like that. So by giving them a number, they can refer to this, and then we can see progression. We can titrate medication. We create compliance by the patient. So behavioral modification is a very strong factor.
So before Endo-PAT or without Endo-PAT, is there any way to predict whether someone might have a heart attack?
So let's have a look at the first slide that we have
Sure. Take a look
today.
at that, Brian.
Okay. So of course we have blood tests, which are not so specific. So what you see on the screen is a progression. It's a cross-section of a vessel, and it's a progression of atherosclerosis timeline. So early from the first decade of life, we form some foam cells that adhere to the endothelium, to this lining of the vessels. Then these foam cells will develop to atheroma, plaque, and plaque rupture. Now the problems nowadays that all the other cardiovascular risk assessment tools gives us the diagnosis somewhere along the end of it. So somewhere when the change is visible, when there is anatomical, mechanical changes. We give you the diagnosis early from the formation of the foam cells while the change is physiological, which is years before the clinical event takes place. So the absence of symptoms doesn't mean that we're healthy.
So, Sivan, this sounds very, very technical. Explain to somebody who might be afraid of the sight of their own blood, how do you actually take this test?
Okay, so let me just start with the fact that around 50% of people that walk to the emergency room with heart attack have no known conventional risk factors. So their first symptoms is sudden death. So what we're doing is trying to imitate, I know it sounds rushed, but that's the fact. The percentage is actually higher in female. So what we're trying to do is to imitate a stress response. So we inflating blood pressure cuff in the arm, so we create complete occlusion. So there is no blood flowing, no nutrients, no blood. And we would like to see how the vessels respond to the stress after we release the blood pressure cuff.
So I know earlier today you administered an Endo-PAT test on my colleague Corey. Do we have a shot of Corey taking the test with Sivan?
Eating a donut.
Maybe why not on the picture. So not exactly the picture of health, but Corey's a young man. And what about his results? How did actually Corey do?
Okay, so we did the test pre and post, before the donuts and after the donuts. And although Corey is very young, he's very devoted to AIPAC, so he was under a lot of pressure here. So what we could see, maybe we can see the slide showing the test before, when Corey had good endothelial function. So what you see in the upper trace is, you can see the segment of time from the baseline, and then the flat line, meaning there is no blood. And once we release the blood pressure cuff, you can see this high vasodilation, the nice warm blood that's flowing to the arm, which means that Corey had good endothelial function prior to eating a donut. And then after he ate a donut, we did another test, and what you see how the difference looks like.
That's the little on the bottom?
Exactly. Well, in the upper trace, you can see that the post-occlusion segment looks more or less similar to the baseline, which means that the vessels didn't release nitric oxide, which is the most potent material that will dilate the vascular smooth muscle. So then we can tell that Corey endothelial function wasn't that good after he ate the donuts. There is a very famous study with a Big Mac.
Is Corey, Big Mac's aside, is Corey going to be okay?
Corey's going to be okay.
I mean, I'm sure there's a doctor here if necessary, but but it's good. But it's a good thing to know, because if he was at risk, he's young enough now that he could take the time to exercise, change his diet if necessary. And that would be what we prevent.
And we give him a number. So according to this number, he can definitely improve.
So this is a preventative tool, Sivan. Yes. Where can people get tested? Where is Endo-PAT being used today?
So until recently, we were able to gather more than 450 publication and abstract peer-reviewed articles by the most leading prestige research centers all across the US, all across the world actually. And recently, in the last 2 years, we shifted from research to clinical application. So you can find many physicians throughout the country having the device in their practice because they would like to change their patient outcome.
Do you have a sense of what we spend each year as a country on either treating or caring for people who've had heart attacks?
A lot. Around $150 billion.
Billion
is being spent only on heart disease. Why? Because we approach the disease too late, when something happened, when we need to do open heart surgery, when we need to do catheterization. So we only approach the disease when something happened instead of preventing it in the early stages.
So Endo-PAT could help prevent even getting to that point at all?
Yes.
So your Endo-PAT is saving lives and money.
And money, and it's from Israel.
And from Israel, changing the world. Ladies and gentlemen, Dr. Itamar Medical.